We have news tonight about the explosion of the West Nile virus. Now in 47 states, 41 people have died and infections are multiplying at 4 times the usual rate. Look at this. 1 month ago, 29 reported cases. Tonight, more than 1,100. The CDC warned the next few weeks could be the worst, and Dr. Richard Besser is standing by right now to give us details about the symptoms. But first, here's ABC's Clayton Sandell out in the field.
In this latest West Nile outbreak, half the cases are here in Texas. That's where Claire McCall contracted West Nile in 2008. She now volunteers at a medical clinic, but years later can no longer work full-time.
I have no short-term memory. I have trouble with word recall, trouble with remembering anything that's happened in the last 5 minutes.
McCall is one of the few, less than 1% of West Nile patients that have the type of illness that makes headlines. Her first symptom, high fever.
I was in total paralysis.
Her paralysis lasted 4 months, but 60% of people with the most severe cases of West Nile will still suffer symptoms 5 years later.
Once the person has the infection, and if the infection becomes severe, the individual patient can then experience lasting and permanent brain damage.
So if you've been bitten, how do you know if you have West Nile and if you're one of those rare, dangerous cases? The vast majority, 80%, won't have any symptoms. Their bodies fight off the disease. For another 19%, the worst symptoms are mild: headaches, fever, nausea. But for less than 1% of people with West Nile, severe symptoms: convulsions, paralysis, possibly even death. After planes dropped pesticide over Houston last night, Salvador Rico is out setting traps, hoping the aerial assault swatted down some of the danger.
I want to see less mosquitoes in these traps. So if there's less mosquitoes, good news.
Mosquito abatement programs are one of the most effective ways of combating West Nile, but many of those programs are now threatened around the country by budget cuts. Diane?
All right, Clayton, thank you. And I'll turn now to ABC's chief medical editor, Dr. Richard Besser. Rich, everybody who's got a mosquito bite is going to be worried. How many days before symptoms would set in?
You know, it can be as short as 2 days or up to 2 weeks. A big range.
2 weeks. And let's go over again. Why are people over 50 more at risk, more vulnerable?
Well, for that severe disease, the virus has to cross over something called the blood-brain barrier, which is designed to keep infections out. We don't know for people over 50 if it's just getting through easier or if their immune system isn't fighting it off. But those people, as well as people with high blood pressure or heart disease, are at more risk for this severe disease.
Okay, I've always said to you, one of the things that drives us crazy is the symptoms we are given are the symptoms for 1,000 things: fever, headache, nausea. How do you know if it's West Nile, and should you go to the doctor anyway?
Well, if you have flu-like symptoms, you can treat that at home. But if you develop confusion, stiff neck, weakness, go see your doctor right away, because if it's the severe form, they can give a medicine to decrease the swelling in the brain and reduce the amount of nerve damage.
But it won't be a close call if you have those severe symptoms?
It won't be a close call. And the good news is, for most people who have this infection, they won't even know it, their body will fight it off, and they'll never get it again.
But the severe symptoms will be marked, so go to the doctor right away. Okay, thank you, Rich Besser.